please.
Yeah, thank you, Dr. Vikram. Thanks for the kind introduction. I'll be sharing my screen right now. And first of all, I would like to thank the AIOC 21 committee, scientific committee, for giving us a chance. And Dr. Vikram, thanks for considering me for this instruction course. Are my slides visible?
Yeah. Yes, Dr. Sumit.
Yeah. So, like Dr. Vikram has said, it's a very, very important that now the patients coming to the OPD, they are the ones who expect a lot, and we should be able to come up to their expectations and give a realistic counseling to them, so that whatever they have a realistic expectation of what is to come. So I'll be starting my talk on that. We all know that the cataract surgery is the most commonly performed ophthalmic surgery worldwide, and it is mostly very safe. But yes, complications do happen even in the best of hands. And the patient counseling is all the more important because of the following reasons. First of all, the medico-legal reason, which is the first and the foremost, very important. Not only in India, but abroad, it is much more important because the medico-legal cases against the ophthalmic doctors are much, much more than against any other specialty. Then the morale of the patient is also affected. If you have a good counselor, if you can counsel the patient well, then the morale becomes much, much better. And it is also ethical for you to discuss all the pros and cons of the surgery beforehand. The cataract surgery has evolved from a vision restoring surgery to eagle vision. Now the patient expects a fine vision, a very precise vision, and to come up to that expectation, we need to understand how the patient behaves. So to ensure happy outcomes, it depends upon the work profile and the visual demand of the patient, the age of the patient at which he comes to you, his economic status, again, a very important consideration for him, the comorbidities he might be suffering like diabetes, hypertension, glaucoma, anything, and the personality types. Always look at the personality types of the patient and understand before opting for the lens or for the type of the surgery that you want to offer to them. Now, how does a patient come to our OPD? Mostly they come with diminution of vision, they have work-related problems or driving problems, or they are referred by a colleague or a friend who says that, yes, you have something and you can go and get yourself tested. And when the patient is told that he has cataract, it all depends upon two factors mostly. The age of the patient at which he comes to you. The younger the patient comes to you, the more expectations he has, and the more precise he would like his vision to be. And the stage of the cataract. If it's an early posterior subcapsular type of a cataract where the patient has a 6x6, 6x9 vision, but his work is somewhat hampered, he will demand more. But if a patient has a mature kind of a cataract where he's not able to see anything, so whatever vision that he gets post-operatively, he's much more happier if he even gets a suboptimal kind of a vision. So what are the expectations of the patient? Now, the patients generally nowadays expect the moon. They want to have a very clear vision. They want to perform all the activities like near, intermediate, and distance with ease. They want to have a comfortable night driving, and they want to perform the day-to-day activities easily. So in summary, they want to have a childlike vision. And why is the counseling very important nowadays? Because this counseling helps us to restore the autonomy of the patient. He has the right to make the correct decision. We can talk about the risk and the benefit ratio with the patient. It allays the patient's fears and ensures realistic expectations. Now, how to go about counseling? Now, first of all, we have to convince ourselves that what is the best treatment option for the patient, keeping in mind his eye condition, number one, the age, his pocket, how much he can afford, the expectations of the patient, and then discuss various options and expected outcomes. Be very clear and realistic about the results and discuss potential risks and limitations there and then. Don't leave it to end when the complication has occurred that, yes, this could have happened. Now, what is covered under counseling? We cover what exactly are we going to do in the patient's eye. So what does the cataract surgery involve? The preoperative assessment, like the PAC, what the other comorbidities the patient might be having, the type of anesthesia which we are going to use, whether topical, local, or the general anesthesia, which type of surgery is being offered, the post-operative care and duration. Duration is very important because the patient expects that as soon as I go home, I should be able to see. So post-operative care and the period of recovery is very important. If we take care of all these things, the patient will be less anxious, will have a better self-confidence, there will be a better relationship with you, and there will be much less stress on you as well as the patient once you have counseled him accordingly. Now, what more to cover? If you want to cover, you have to cover the type of the surgery, the type of IOL that you are going to implant in him, the expected outcome of that IOL and the surgery, and the expected time of recovery, common post-operative problems, and most importantly, the cost of the surgery. Cost of the surgery has to be genuinely told beforehand so that the patient doesn't crib or say that this was not told to me earlier. Now, the pre-operative assessment, it involves a whole lot of things which will be covered by Dr. Soumya in her next talk, but mostly we'll cover the lid hygiene, the cornea status, the AC reaction, the pupillary reflex, the grade of the cataract. Other things have to be covered. Then the type of the surgery that Dr. Amit Porwal will be covering, and what all tips are required, the phaco, femto, SICS, ECC, whatever is best for the patient. Again, the type of the IOL has to be judged, has to be according to the patient's needs and his pocket, whatever the patient desires. And one word of caution that the candidates who are strictly type A personalities who are unwilling to normally long or short eyes are not good candidates for premium IOLs. So just be aware. And expected outcome, we have to look at the patient's expected outcome. We judge it by the pre-operative condition like any glaucoma or ARMD that the patient might be having, the comorbidities like diabetes, hypertension, anything else, and the type of surgery that we have performed. We should always tell them about some post-operative problems that they might have, some redness, some pain, mild itching, foreign body sensation, watering, because one patient might tell the other patient that he did not feel a thing. So the next patient, if he feels even a pinprick type of a thing, and he'll say that, no, my surgery has gone wrong. So it's always better to tell them that these are the common problems that you might be facing. The post-operative care again will be taken up by Dr. Amit, and it is very important that tell them about the lid hygiene, the restrictions that the patient needs to have, and be patient to the patient's problem. Always reassure them and tell them that yes, all is well, and we are willing to make the change if required. Always good to have the flyers like this in your OPDs so that you can just tell them that these are the restrictions. So my carry home message would be that the proper counseling plays a very important role in happy patient outcomes. You have to tailor the counseling according to the individual needs and his expectations. Be very realistic with the patient, always under promise and over deliver. And if we are able to do that, yes, we are going to have very happy and very thankful patients. Thank you so much.
Thank you. Thank you, Dr. Sumit, for very well covering the pre-operative expectations.